So today is the official opening of our intensive care unit. Around 5 years of work, £3 million of investment to bring it to the stage we're at now, that we're able to receive patients in here for open cardiac surgery. So we're able to treat the 5 most common surgery types in cardiac surgery here today. Those include things like CABG, or cardiac bypass surgery as the public will call it, or various valves within the heart that need replaced or repaired. So covering that broad range of probably about 70 to 80% of all cardiac procedures.
So back in 2016 I was diagnosed with mitral valve prolapse and told that obviously the condition could deteriorate over time, and looking at a possible waiting list of around a year on the NHS, we went down the line of private medical insurance, which led us here to Kingsbridge Private Hospital.
Throughout his the 10 days that he was in hospital, a phrase that he did use was that he was cared for by his guardian angels. The care that we received and the communication that we received was remarkable.
You certainly could have told a different tale if I still had been waiting on the NHS waiting list. Recovery's been good. I do feel a lot better, and getting back to just the normal things that I was doing before surgery.
Well, the demand and the capacity don't meet in Northern Ireland. There's a lot more patients needing cardiac surgery than the system is able to cope with. And as an outflow of that, we send about 200 patients a year across the border to Dublin, or alternatively across the water to England, Scotland. So in order to try and help that and keep them here locally and keep them in the economy here locally, we've opened this facility today. We've named it after Professor Jim Dornan. He was one of the founding consultants here, first working here in 2011. And of course, sadly, Jim passed away last year. So we thought it was fitting to name it after him, the Professor Jim Dornan Cardiac Intensive Care Unit.